Welcome back. Once again, it's your boy Abdul, the Health Man. I am your neighborhood health man. This is the Health Man Show on Grown Folks Podcast. Also, you may be checking this out on YouTube. If you ever want to be a part of the podcast, you can always reach me on the podcast on Sunday nights between 9 p.m. and 10 p.m. on Sunday nights. You can call into the podcast at 520-525-8633. Once again, that's 520-525-8633. This is the Grown Folks Podcast. So if you're catching this on YouTube, you can always call on Sunday nights between 9 and 10 p.m., and this is what I do this show. We have a good show today. This is more about women's health. We're going to be talking about fibroids. And why fibroids? Because so many people have them. I get at least once or twice a week in the shop, we hear people talking about they're dealing with fibroids, especially black women. So we wanted to get into fibroids. But before we did start that, do you see I'm looking pretty fresh right now? It's the new camera. I'm going up. Y'all see it? I'm 1080p in it now. I'm not 720 in it. I'm 1080p in it. And maybe in the future, I may go to 4K. So as we continue to do these videos, we're going to get fresher and fresher. Somebody told me I need to change my background. This is my office. So they told me, hey, why don't you do something about the background? So in due time, I'm going to create a new background and all the other stuff. But right now, we're using my office. But right now, we 1080p in, baby. 1080p in. Okay? So let's talk about fibroids. Let's go through. What are fibroids? And I'm reading this. Uterine fibroids are growths in your uterus. Between 60 to 80% of women have or had fibroids. They are called benign tumors, uterolimomas, and myomas. Limoyamas? That's different. I never heard that. While fibroids aren't cancerous or life-threatening, they are sometimes can cause health problems.
Can come in here for when it's raining.
Fibroids, if you're going to be on, can you put yourself on mute?
Water bug. No.
It's not on mute.
It's just.
There we go. They are also, fibroids can range in the size of small to as a seed or as large as a grapefruit. That is true. I actually had a lady come in and she had 4 fibroids the size of grapefruits. 4. You would think she was 7 months pregnant, but it was literally she had fibroids, right? Symptoms of fibroids. A period that may last longer than 1 week. Heavy menstrual bleeding. Seeing that awesome. I know someone who comes into the store, she bleeds excessively, like she bleeds more than 8 days, and she uses the biggest pads to help deal with that. I mean, it's really bad, and sometimes she even has a period almost like 2 weeks. Spotty bleeding or bleeding between periods, pelvic pressure or pain, backaches or leg pain, frequent urination because the fibroid can grow and it can push up against the bladder, difficulty emptying your bladder, constipation, and difficulty getting pregnant. You may be at higher risk for fibroids if you are between the ages of 30 and 50, if you are overweight or obese, African American, so African American women have more than 2 to 3 times more common. Fibroids are 2 to 3 times more common in African American women. Have a family history of fibroids. Begin menstruating before 10. I didn't know that. So I guess if you start your menses early, you have a greater chance of developing fibroids. If you use certain type of birth control, have a poor diet, and consume alcohol. You have different types of fibroids. You have fibroids that go on the inside of the uterus. Okay, that's called intramural fibroids. You have fibroids that grow in the hollow part. That's called submucosal fibroids. And then you have something called subserosal fibroids. those grow on the outside of the uterus. Okay? So we just talked about some of the things that, what are fibroids, how they affect you, for some of the symptoms of fibroids, who are at risk of fibroids, and things like that. Now, it's very common, like I said, I find to be very, very common in black women. 2 to 3 times more common in black women. So that's one of the reasons why I want to talk about this, because I see so many black women dealing with fibroids. It's unreal. It's really unreal. Fibroids are these masses that grow inside the uterus, and they cause excessive bleeding. One of the things that they found that can cause the growth of fibroids is excessive amounts of estrogen. So one of the likely causes of fibroids to grow is excessive amounts of estrogen. Well, one of the things that creates more estrogen in the body is fat cells. They find people who are overweight or obese are at greater chance of developing fibroids or having really bad fibroids, like the really big fibroids. So one of the leading causes of fibroid growth is estrogen. Every woman has estrogen. Even men have a little bit of estrogen. Every woman has estrogen, but excessive amounts of estrogen that's produced from the ovaries is because we have excessive amounts of fat cells. The leading cause of the growth of fibroids are overweight and obesity. Okay? Remember we did that whole video about you're fat, now what to do about it? And we talked about all the issues that happen from being overweight or obese, all the health issues. Well, uterine fibroids are actually one of the issues that is not necessarily caused by that, but it caused the obesity and being overweight causes them to grow much faster. So one of the treatments that they always tell women is one of the first things you can do is lose weight. Okay? Is lose weight, because the fat cells makes the body secrete the ovaries secrete more estrogen. More estrogen. So you gotta lose weight. And they're talking about why black women are some of the highest, 2 to 3 times greater when it comes down to dealing with fibroids. And one of the things that we talked about in our previous video, in the previous podcast, is that 80% of all African American women are considered overweight or obese. And we are 2 to 3 times more likely to have fibroids growing. And we also 50% of 50% of all black folks are overweight. That male and female, and 80% of black women are overweight or obese. So we're looking at a weight issue, and we're looking at an explosion of growth in fibroids. Now that's not necessarily causation, but there is a correlation there. Okay? So when it comes down to black women, there are other things that they're looking at that may cause the growth of fibroids. Possible causes. Having less than 2 children. I didn't know this, okay? So the least if you have less and less children, you're more likely to have fibroids. And that could be a cause. And women back in the day used to have a lot of kids, you know? Nowadays, most people are having 1 or 2 children, if that. So some women don't have any. You know, they're choosing not to. So having less than 2 children, you have a greater chance of growing fibroids, okay? Not causation, just correlation. They're just finding this. Drinking alcohol. Nowadays, everybody is a winosaur. They back in the day used to call them winos. I'm not saying you're a wino. I'm just saying a winosaur. You know what I mean? Like everybody knows now the red wine, the white wine. They know the best ones. When the grapes are grown and did they get enough sunlight? And I sip mine with I sip my red wine and my Pinot Grigio and this. It's everybody's drinking. It seems like much more people are drinking alcohol. But alcohol is also a contributing factor to the growth of fibroids. So cut back your alcohol, right? Especially beer. No beer. I hope you're not drinking too much beer. Not eating enough fruits. Not eating enough fruits, they find, is another contributing factor to fibroid growth. And it makes sense. We already know fruits are anti-carcinogenic, anti-cancer effects. fibroids grow as though they grow like benign tumors. Okay, they're not cancerous, but they grow like benign tumors. So not eating enough fruits is one of the cause of the growth of fibroids. They believe that's one of the causes. Starting menstruation early. Remember I said that? I'm going to read this. Fibroids are sensitive to hormones, especially estrogen. This may explain the fact that women who begin menstruation before the age of 11 are more likely to develop fibroids compared to women who begin menstruation after the age of 13. Okay? So, that's just saying, because fibroids are estrogen sensitive. Since they're estrogen sensitive, if you start creating estrogen much earlier, you're more likely to develop fibroids. Not saying that it's going to happen. Remember, this is not causation. This is a correlation. Okay? Vitamin D deficiency. Remember the video we did? We talked about vitamin D. We talked about how African American people or melanin-based people do not make enough vitamin D because of the environment we live in. Okay? Now we're talking about African American women or black women in general right now when it comes down to fibroids, because remember, 2 to 3 times the amount of black women get it more than any other group. Now, every group gets it. I didn't even know this. Chinese get it. White people get it. Spanish people. All groups get fibroids. It's just African Americans are 2 to 3 times greater to develop fibroids than any other group of women. Okay? Now, they're saying it may be a contributing factor is a lack of vitamin D. A lack of vitamin D. And when you think about it, let's go through the path of this. Let's go through the history of this. Years ago, we worked more outside. We were in the southern states, especially in America. We were more in the southern states. We got more sunlight. The prevalency of fibroids were lower. We come up north, we work indoors more. We're covered more. We are not exposing our body to sunlight the same way. What does that do? It causes a vitamin D deficiency. 80% of all African American women in America are deficient in vitamin D. 70 to 80% of all African American women are deficient in vitamin D. Now, men are deficient in vitamin D too, but women are a higher rate of vitamin D deficiencies because they work more indoors. Men just in general work more outdoors. It's just, I don't see too many women outside laying asphalt. I don't see too many construction working women. You may have them, but they're not as frequent. They're not as many as men. That men are more prone or more likely to work outdoors than they are women. So women are not being exposed to as much sunlight. Black people make vitamin D much slower. Why is that? Because we come from an environment in which it requires us to get more sunlight. That's what melanin does. Okay? You need more sunlight. Sun is beaming on your skin all day. Your body is creating vitamin D slower. It makes sense genetically, because if you made it as fast as someone who had less melanin, you would develop vitamin D toxicity. So vitamin D deficiency is one of the correlations of fibroid growth. Okay? Prenatal exposure. Prenatal exposure. These are chemicals and things that can affect you while you're in the womb. Okay? Prenatal exposure. There are synthetic estrogens that we have been consuming. Your parents have been consuming. It's found in the meats. It's found in the plastics and all those other things. Those prenatal exposures give you more estrogens. So when you're born, you already have a larger amount of estrogens in your bloodstream, synthetic estrogens, than what you really would have had if it wasn't for these prenatal exposures. Exposure to childhood abuse. Now, I'm going to read this to you, and I'm going to go into this. It seems logical that being exposed to childhood abuse is tied to physical and mental health problems. Study has shown a connection to the development of uterine fibroids and exposure to abuse in early life. While nothing can be done to change what happened in the past, one of the best things you can do for yourself is take care of your physical and emotional health. Okay? Physical and emotional abuse as a child. I'm going to drop some jewels on you. In Chinese medicine, women hold emotions in two places. They hold it, no, three places. Liver, heart, and womb. Let's say it again. Liver, heart, and womb. I had a Chinese herbalist I worked with for years. He passed away. Really good. It was a brother too. Bad. Studied medicine for 40 years. Bad brother. He said one of the prevalences, when it comes down to a prevalence of fibroids growing, he said there's a lot of trauma that women deal with, and they store that pain in their womb. He said they store that pain in their womb, and that's why you have so many female issues. Endometriosis, fibroids, a lot of these issues like that. So many health issues when it comes down to womb health is because of these emotions that's been stored in the womb, and the body reacts to it. Remember, emotions has a physiological response. Okay? Emotions have a physiological response. All right, we're going to say that one more time. Emotions have a physiological response. If you get angry, you literally get hotter. Okay? Your muscles tense up. You have a physical response from it. If you are depressed, your body creates all these hormones because of that depression. You have a physical response from it. Okay? Using hair relaxers. That's right. Hair relaxers has phthalates in there, a group of chemicals that are considered to be hormonal disruptors. Okay? Now, we already talked about how estrogen affects your fibroids growth. Now we're talking about there are things like relaxers. Women get their hair permed and all those other things. Because you get your hair permed, remember, your skin is your biggest organ, and your skin absorbs toxins. So you are getting a relaxer in your hair. You're getting your hair permed. You're getting your hair did. You know what I'm saying? Well, those chemicals that's going inside, that's breaking your hair follicles, these bonds in your hair are being absorbed by your skin. And guess where they go? Those phthalates are estrogen mimicking. So they affect your fibroids, and they can cause them to grow. Experiencing major life stresses. That just makes sense, you know? That just makes sense. You know, you have stress. When you are stressed, things act up. When you are stressed, you have more prone to heart disease. When you are stressed, you have more prone to cancer. When you have stress, you are more prone to being fatigued. When you have stress, you create more inflammation in the body. There's a lot that comes with stress. So experiencing a lot of stress, you know, you ever hear somebody say, man, I'm stressed out, it's causing me an ulcer? Yeah, well, it literally is causing you an ulcer. It can cause you an ulcer. Stress can cause you an ulcer. Okay? Well, stress can make a fibroid grow. Women who are going through times of large amounts of stress, their fibroids grow bigger. That is known. They'll tell you, if I'm stressing out, my period is, I'm bleeding heavily this month because I've been really stressing. And then genetics. Genetics has a role in this. It is more prone that black women do get fibroids 2 to 3 times more than any other group because it is have a genetics in there, genetic predisposition in there. There are a couple of black women that we've heard of that that you may know that talked about fibroids. Beverly Johnson, you know, the supermodel. Beverly Johnson, remember her? Bad. She was fine back in the day. Woo! Beverly Johnson. She had a whole article talking about how fibroids tore her up. Eve. Oh, man, I used to love Eve. Oh, man, what's her name? She was I loved Eve. Her first album, I used to play it. It was one of my theme songs. I had a theme song on that first album. It was with her. This is telling my age. It was her and Drag On. Is that who, what? But I used to drive down to go see my wife in Philly at the time, and that was one of my songs I played every time I went down to go see her. So Eve, the rapper Eve, she complained of how fibroids have literally, like, caused her so much pain. caused her, like, how heavy bleeding. She talked about it. One of the housewives of Atlanta, Kenya Moore, talks about her fibroids and how it was very difficult on her. So there's a lot of people. Where's another one? I forgot her name. God, I can't think of her name. There's another one I can't think of. But these are people who are dealing with fibroids. Any questions right now? Come on, talk to me. Anybody got anything to say before I go on to treatments for fibroids? Nothing right now? Okay. You see I'm shining with my 1080?
It took me a minute.
Okay.
How do you there's two questions. How are fibroids identified, and what do you do about it to get rid of them?
Okay.
Besides losing weight.
Good question. One of them we're about to answer in a second. Treatments for fibroids, okay?
Okay.
How do they identify them? A lot of times women go in and they get an ultrasound. Ultrasound can see fibroids. They go in and they can see actually the same way they can see the baby with an ultrasound, they can also see the growth of fibroids. Most of the time women go in because they may tell the OBGYN, hey, listen, I'm bleeding real heavily, I'm doing this, and the OBGYN will say, let me check you out. And they say, oh, yes, you have fibroids. You have one on the left side, you have a 2-centimeter fibroid, you have a 3-centimeter fibroid, you have a really small one, just watch it. They'll tell you most of the time, just watch it, okay? But they don't really go into, unless it's really big, they really don't do too much about them. So let's get into the things that treat fibroids. Man, I had a whole thing up. Where's it at? Oh, my God. I'm going to show you right here. Give me one sec. Okay, here we go. One of the first things they use to treat fibroids is, one of the main things back in the day was a hysterectomy. A hysterectomy is basically a surgical procedure in which they take out the whole uterus, and even they can take your ovaries. So a hysterectomy was one of the main ways of them treating fibroids. They said, okay, well, listen, we just can't cut these little things out the way they are. They got a couple of them. Let's just take your whole uterus out. Okay? We'll just take your whole uterus out, and we'll take your ovaries. When that happens, you get no more fibroids because they can't grow anymore because there's nothing there for them to grow. But you instantly go into menopause. So if a woman they try not to give hysterectomy to young women because you can't have any more kids if you plan on to, and you instantly go into menopause, okay? They also have something called a myomectomy, where they just remove the fibroids, okay? So they have surgeries now where they can get in, cut the fibroid out without taking out the whole uterus, and that's called a myomectomy. The problem with a myomectomy is sometimes most of the time, the fibroid will grow back, okay? They have another method in which they freeze the fibroid. You ever seen somebody get if you ever dealt with a wart, you can either get a wart cut off or you could get a wart froze. And freezing a wart will freeze the roots and the wart will literally fall right off, okay? They have another one called uterine artery embolization. This is a real becoming popular. What they do is that they actually cut off the blood supply to the fibroid. Remember, fibroids are they remind you of a non-cancerous tumor, okay? A non-cancerous tumor. A fibroid will grow literally like you would think it was a cancerous tumor, but it's not. It's non-cancerous. But it creates its own blood vessels. It makes the body create its own blood vessels. So a fibroid has blood vessels going to it. As it gets bigger, it makes the body create more blood vessels to go to that fibroid to feed it because it's a living entity. It cells. It wants to keep growing, okay? So a uterine artery embolization basically gets rid of the blood vessels going to the fibroid, okay? So they basically burn off the blood vessels that go into the fibroid. The fibroid slowly but surely dies off. Okay. They also have the MRI guided focus ultrasound surgery, so they can actually use sound. This is sometimes modern medicine be some fly stuff. They can actually use sound to do surgery. Okay. And then they also have hormonal medications that can help you with that too. So they use medications to help block certain estrogens and things like that to make the fibroid become smaller. So those are some treatments that you can do to deal with the fibroid itself, okay? Now, we're going to get into the fly stuff, the stuff that the health man knows, okay? Fibroids coming from examples of people coming into the stores. Now, I've been doing this since 1994. I started in 1994, and now it's 2022. So I'm 28 years in the game. I've seen, no exaggeration, probably close to about 500, maybe 600, 700 women when it comes down to fibroids. I've probably seen even more, but I'm going to give myself a lower estimate. About 600 to 700 women come in for fibroids. Fibroids are one of the most difficult things to deal with because treating fibroids with natural supplements or helping the body break down a fibroid with natural supplements takes time. It takes time. And this is the one thing most women want really fast, is it to kind of speed up. The number one product I've ever seen to help with fibroids is a product called Dissolving. Okay? Dissolving. It's a Chinese herbal formula. BD212 dissolving combination. This can break down a fibroid a centimeter per month. This is the most effective thing I've ever seen. It uses about 14 different Chinese herbs. Mixture, this combination can dissolve a fibroid. I've seen it dissolve it even faster than that, but the average about a centimeter per month. When you're doing this, there's foods, and I'm going to go on some other supplements that can also help. There are foods you can avoid. The number one food you want to avoid when you're dealing with fibroids is dairy. The number one food is dairy. You want to eliminate anything that's going to cause the body to create more mucus. Okay? Mucus is a protective barrier for the body. You want the body to eliminate mucus, and you have to get rid of dairy out the diet. You need the lymphatic system to work properly when it's breaking down the fibroid. Okay? Because that's one of the things that your body's going to use to eliminate those toxins out. Okay? So you got to avoid dairy. Secondary thing, you got to avoid starches. You got to avoid starches. Starches affect your insulin level. Insulin level is a hormone. Insulin is a hormone. Anabolic hormone at that. It builds things up. It makes the body store fat, and it makes the body turn sugar, store it, and it turns it into store it into fat if need be. Okay, we went through the whole thing about how insulin works and gluconeogenesis and all that in the liver and all that stuff. But having large amounts of insulin shows you're eating a tremendous amount of starches and sugars, and those things are going to be converted to fat if you're not burning them off. So you want to keep the starches down because you don't want the body to be creating more fat cells. Okay? Because what does fat cells do? It makes the body secrete more estrogen. And what does estrogen do? Estrogen makes your body make the fibroid grow larger. So you're eliminating dairy out the diet. You're eliminating starches out the diet. You're consuming more fruits, especially in the berry families, because they have an effect on stopping things from growing, okay? I'm going to just keep it like that. Anti-carcinogenic, anti-cancer, antioxidant. You want to do some of the, you can do some of your citrus fruits because they have a pulling, especially some of the melons, really melons, if it's still in season. They have a pulling effect on the lymphatic system, so you want that to work, okay? You want to consume clean proteins, and you want an omega-3 rich diet. Omega-3 rich diet. You want to consume clean proteins. You want to consume nuts. You want to consume fish if you want to. It's up to you. You want to avoid shellfish, okay? You want to avoid, actually, this is the crazy thing. You actually may want to avoid chicken. I would hate to say this, but you better off probably doing grass-fed beef or something like that. But you want to, because chicken a lot of times have a lot of estrogens in them, unless you get them organic, okay? And you want to drink a lot of water while you're doing this. So avoid the starches, avoid the sugars, avoid dairy. Consume a lot of fruits and vegetables. You want to do clean protein and foods that's rich in omega-3. Omega-3 creates prostaglandins. That balances your hormones. That balances your hormones. So your estrogen is not here causing that fibroid to grow. It balances it. All right, get back to the supplement. Okay? Dissolving. Number one supplement I've ever seen. Dissolving. Breaks down the fibroid in about a centimeter per month. It's a Chinese herbal formula by a company called Secret of the Worlds. Dissolving formula. Number two. This is the formula that's relatively new, but we're getting great results. I'm actually seeing this work. Dissolving I've seen work since the 90s. That's why I said the number one for me. It may be not, somebody else may have a number one formula. This is number one formula for me because I've seen it work since the 90s. At the store I worked in Irvington, they had it there. At the store I work at now, they have it there. Dissolving, number one formula for dealing with fibroids that I've seen. Number two, we have a formula on the market is by a company called Body by Lathan. It's called the fibroid formula. The fibroid formula helps reduce the size of fibroids, helps stop with excessive bleeding, and it can destroy the root structure. This is very important. When dealing with a fibroid, when you're getting treatment, a natural treatment for a fibroid, is not only breaking down the actual fibroid itself, it is actually, its job is to get rid of the root structure. Get rid of the root structure. Why is that? Why get rid of the root structure? Because as you've seen in a, what is it called? A myomectomy, hysterectomy, myomectomy, yes, they can cut out the fibroid, but it has a tendency to grow back. Think of a fibroid as being like a weed. Think of a fibroid. This is the best example of a fibroid. Think of a fibroid as being like a weed. If a fibroid is like a weed, and you go outside in your garden, you chop a weed down, is it going to grow back? Yes, it is. Because you didn't get rid of the root structure. What they do in the myomectomy, they cut the fibroid out. They burn them out, whatever else. But the fibroid has blood vessels and it has a root structure. It wants to keep living. They may cut all around, try to get all the little area out, almost like scoop it out if you want to say that. But if you don't get everything, it will grow back. Dissolves, breaks down the root structure. Once you get rid of the actual fibroid, you stay on there for about another month and a half, gets rid of the root structure. The Body by Lathan the fibroid formula, its job is to get rid of the root structure too. The key is to get rid of the root structure. Number three, this is another one I've seen. It's been out for a long time. It's a tea called One Love. That's the name of the company, One Love. Womb tea. W-O-M-B-T. Womb tea, like clean your womb. This tea is excellent for dealing with yeast. This tea is excellent for dealing with women who have BV, bacterial vaginosis. This is really good for just cleaning the womb. Excellent for dealing with fibroids. It's excellent for dealing with fibroids. Okay? So womb tea is another good tea by a company called One Love. All right? There's other things you could do. There's a company out there, it's been around, my Jamaicans may know about it. It's called Sundial. This is a company called Sundial. They make a formula called African Woman Back Tonic. This is a formula good for women just in general. It helps deal with back pain. It helps deal with yeast. It helps deal with hormonal imbalance. It builds your libido back up. So women who are not sexually active because their hormones are low, this formula is really good for that. And since it balances hormones, it has been shown to reduce the size of fibroids over time. The Woman Back Tonic is really good by Sundial. Okay? Then there's herbs that you can do. we're going to talk about some herbs that you can do. You can do an herb called chaparral. Chaparral. I think it's C-H-A-P-P-A-R, no, C-H-P-A-R-R-A-L. Chaparral. Chaparral is a Midwestern herb. The Native Americans used to use it to get rid of large masses, cancer. This was one of the things they used to help fight. Chaparral is an excellent herb. Chaparral is a really good herb for cleaning the womb, but specifically designed for dealing with fibroids. Really good. And if you really want it to work well, it's okay by itself. It works really well if you mix it with red clover. Red clover is a blood purifying herb. Red clover is really good for balancing hormones, reduce excessive amounts of estrogens. Everybody thinks estrogen is great. It is. It's a beautiful hormone for women. You don't want excessive, like you don't want excessive testosterone. You don't want excessive estrogen. Red clover balances that. It acts as a phytoestrogen. What does red clover act as? A phytoestrogen. What is a phytoestrogen, so you understand? A phytoestrogen is plants that mimic estrogen, but are not estrogen. They actually block rogue estrogens. So think of a rogue estrogen as like some of the plastic we get, like the PUFAs out there and things like that. There's a lot of rogue estrogens. Some of the pesticides. This is why it's very important to eat organic if you can. Some of the pesticides mimic estrogen in the body. The way the body, the liver breaks it down, it makes it mimic estrogen. So you have these rogue-like estrogens. Well, the body don't know the difference between a good estrogen and a bad estrogen. The body said, hey, shit. Oh, excuse me. Hey, that's the estrogen right there. Let me put you on here. Boom. And that's a rogue estrogen. Okay? And you have all these other estrogens. The body wants to hold on to them. The phytoestrogens say, hold on a second. Let me jump on that receptor site. Let me block the door for them not to come in. So the phytoestrogen jumps on there and say, no, you rogue estrogen. You can't come here. I blocked the door. You can't get inside. Stay outside. That's what red clover does. It's a plant that has phytoestrogens. This is where you hear a lot about soy. Soy is bad for you. Soy is bad for you. No. Excessive amount of soy is not great for you. But soy is a phytoestrogen. That's phytoestrogen. It blocks rogue estrogens. That's why soy can help with menopause. But you don't want too much soy when you're a man either. You want a little bit, not too much, okay? Chaparral. Chasteberry is also another good herb that's really good for dealing with fibroids. Chasteberry. Why is chasteberry? Because it balances the hormones. Chasteberry, better known as Vitex, V-I-T-E-X, berry. Vitex or chasteberry, chasteberry, C-H-A-S-T-E berry. Really good if you're dealing with fibroids. Okay? Chickweed, excellent herb for cleansing the lymphatic system. We just talked about dealing with, we need the lymphatic system to be clean to make sure the fibroids are working properly. To get rid of the fibroids, you need the lymphatic system to be clean. Chickweed helps with that. Cleavers help with cleaning the lymphatic system. This will also help you with your fibroids. There's a green food. Well, burdock root also is really good for fibroids. And Dong Quai is a Chinese herb called Dong Quai. That's also really good for dealing with fibroids. Pennyroyal, Pennyroyal, pennyroyal helps with fibroids. Now, these things work good, but then you better off working in combination. The first 4 formulas I gave you were combinations. And why combinations better? Because combinations have multiple herbs in there that's working simultaneously for the same purpose. The dissolving formula does what? It breaks up fibroids, it gets rid of the root structure, and is a powerful detoxifier of the lymphatic system. And what did we just talk about what we need to do when we want to deal with fibroids? We want to detox the lymph. That's very important. The body bilating fibroid formula is a powerful blood cleanser. It has a good effect on the lymphatic system. It breaks down fibroids and it prevents the root structure. Same thing with the womb tea. Same thing with the sundial African woman back tonic. All these things are really good. Now, there's other fibroid formulas out there. These are the ones that I've actually seen work. I don't like to say many different things because if I haven't seen them work, I don't want to give you wrong information. Okay? You may give me information on this, but I'm telling you, this is what I've seen actually work. Taking vitamin D and vitamin C helps too with vitamin A. They find that selenium also can help with it. Okay, selenium. There's a mineral called selenium. Very good for dealing with fibroids. And then you have the green foods. Okay, green foods. Becoming more chlorophyll rich helps break down and dissolves fibroids. Over time, it's not as effective as the herbs I told you before, but these things have a great effect. Giving yourself green foods like spirulina. One of the best for dealing with fibroids, if you want a green food, it is chlorella. Chlorella is an excellent green food for helping you deal with fibroids. I'm going to give you the top 4 green foods for fibroids in order for fibroids. Chlorella, number 1 for fibroids. Okay? Number 2, barley grass juice. Barley grass juice has SOD, superoxide dismutase in there. It's a green food. Really good for antioxidant, excellent for detoxifying, really good for dealing with keeping the fibroids under control. Okay? Chlorella is number 1, though. No green food is better than chlorella when it comes down to dealing with fibroids. Number 2 is barley grass. Number 3 is wheatgrass. Number 4 is spirulina. In that order. Chlorella is number 1. Barley grass is number 2. Wheatgrass is number 3. And spirulina is number 4. If you could do all of them, that's great. But if you had to pick and choose and you said, listen, I'm on a desert island and I only have one of these 4 green foods and I have a fibroid the size of a grapefruit, what green food should I take? And that is chlorella. Okay? So those are some of the things that we can use daily that help you with a fibroid. Now, I'm going to open up the floor to questions and everything else. If you want to talk about anybody you know who dealt with fibroids, anybody, if you've dealt with a fibroid, and one of the things is if women can hold out, once you get past, menopause, your fibroids start to decrease on their own. They start to reduce in size because your reduction of estrogen. Talk to me. Let's do this.
Good evening.
Good evening. Who's? Say your name and then start.
This is Kia.
Kia.
First of all, I want to thank you. Thank you for sharing your knowledge and your time. It's very well appreciated.
No problem.
My first question is, what's your opinion on moringa?
Oh, moringa is excellent. You may know, you may not know. I'm a connoisseur of moringa. Okay. There are different types of moringa. You have moringa grown all over the world, right? Where it comes from, depending on how it affects you. Most people think moringa comes from Africa. 90% of the moringa you got on the market comes from India. Okay? There's only a few African moringas out there. But moringa is excellent. Excellent detoxifier. Really good at alkalining the body. Really good for giving you calcium, magnesium, iron. Excellent source of protein for green. Okay? In times of starvation, people used to literally live off of moringa. Moringa controls the blood sugar. Moringa is good for blood pressure. Moringa has it feeds the probiotics. And moringa, depending on the species, can cleanse you out as far as your colon. Like African moringa will actually make you go to the bathroom for the first 4 or 5 days of using it until your body gets acclimated to it, and then it becomes nourishing. Indian moringa is more nourishing in the beginning, while African moringa is more cleansing and becomes more nourishing. So I actually think African moringa is a tad bit better because that cleanse, it actually kind of flushes the system first and start to feed you. It's like cleanse and feed, so it's a cool thing. But that's but what about moringa? As far as for fibroids, any green is going to help with fibroids. Any green is going to help with fibroids. Broccoli, any Brussels sprouts, cabbage, moringa, all those things like that, collard greens, those things are meant to help you with fibroids because you want to dissolve mucus, You want to have a cleansing effect. You want to nourish. If you nourish the body can help heal itself. But you got to give it what it needs to heal itself. But yes, I'm a big fan of moringa.
Okay. And then my next question, I only have two because I don't know if anyone else has questions. Taking the supplements or the teas, will it cause any abnormal bleeding? Well, I don't want to say abnormal, but just bleeding outside of the 28-day cycle.
Okay. So having fibroids in itself, when they get large enough, most women have abnormal bleeding. They will bleed heavy. I'm talking about, I know women who literally have to use almost like Pampers. They bleed so heavily. I had a woman come to the store. She bled for 14 days very heavy. They had to give her a blood transfusion. She was bleeding so heavily. So when you start with these things, one of the first benefits you get when they start to work, when you actually starting to see results, is that you're not going to bleed as heavily. Now, I've known 2 women who've used the dissolving formula. In the first month or 2, they bled a little heavily, and then it stopped. It slowed down tremendously after the second month. I know a woman who just was bleeding heavily one day, and half the fibroid broke off. She came in the store and was scared to death. But she went to the doctor, and they literally said she had a 7-centimeter fibroid. When she went back to the doctor, she had a 3-centimeter fibroid. It literally broke off. I'm not sitting here saying that's going to happen to most women. Most women, they don't notice anything. It just slowly but surely gets smaller and smaller, and they notice some of the symptoms. The first symptom they notice, they're not bleeding as heavily. The second symptom they notice is that they have an enlarged stomach, like their stomach is poking out, is going down. Third thing, some women actually complain about back pain and things like that. I had a woman say when she had sex, it was actually caused the pain because it was like the fibroid was kind of moving. I've never heard that one before, but that was one of the symptoms she noticed, that she's not in pain anymore. So everybody and the symptoms you're gonna get is different. But would you bleed excessively? I've only seen that about 2 women in the first month or 2. They bled a little heavier and then it went away. But their fibroid was literally getting smaller. They were bleeding a little heavily because it was breaking off pieces of the fibroid.
Okay.
Anybody else? And I'm not saying that's for everybody. It's going to happen to everybody. 95% of the women don't notice it. They just notice the reduction of the symptoms that come from the fibroids.
Thank you.
No problem. Anybody else? Anybody else know anybody who's dealing with fibroids? I know, man, I have seen, no exaggeration, maybe 600, maybe more. I think I've seen over 1,000 women with fibroids in the period of time I've been doing this. Not everybody want to talk about it. Some women are embarrassed about it, and I don't understand why. It's not something to be embarrassed about. But it's things you can do that does not require you to take out your whole womb.
Right.
You don't have to take out your whole womb. Listen, let me tell you women something, and I'm going to say something. Y'all do stuff that men would, you got to fight tooth and nail. You tell a man to take off his balls, and I'm not even being raw with it. I'm being real. A man will almost prefer to die before he take off his balls. What? You're going to tear off my balls? Let me go. Let me go. They'll tell a woman, listen, you have fibroids, 3 of them the size of 4 centimeters. We got to take out your womb. And a woman be like, okay. And I'll be like, oh, you just going to let somebody take out your womb? You don't investigate any other way of getting this done? You just going to let somebody take out your womb and your ovaries? That's major. That's not a small thing. So go ahead. Somebody got a question?
Yeah, I was gonna say something. I've known people who had fibroids, never really understood what it was because they just say, oh wow, my fibroids are really acting up right now.
Mm-hmm.
I didn't. But so thank you, because this is something I've never had to deal with. Thank God.
Yeah.
But the question is, are the fibroids that people get them or don't get them. Does it have anything to do with your cycle at all?
So the actual fibroid itself doesn't have anything to do with the cycle.
Okay.
The fibroid can affect your cycle. The fibroid can affect your cycle, but it doesn't have anything to do with your cycle. As we said earlier, women who get their cycle earlier in life have a greater chance of getting fibroids because it is estrogen. It loves estrogen. Estrogen stimulates the growth. So if you start having your period at 10 years old versus somebody who started their period at 14, you got 4 more years of estrogen being pumped at a high level, causing a possible growth of a fibroid. But the actual fibroid itself is not caused by your actual your menstrual cycle, anything of that nature. So that's not how it's caused. They don't actually know what actual causes it. They just know these are things these are correlations that they're finding. They're finding, listen, fibroids wasn't as prevalent as they were like 40, 50 years ago as they are now. There are many different causes on why. One thing we talked about is these rogue estrogens. Well, there's certain plastic that has create rogue estrogens. Well, what are everything's in nowadays? We have so many plastics, right? We put our food in plastic. All this stuff is getting into our system. Secondary thing, right? Not only we have these rogue estrogens from plastic, we have rogue estrogens from your food sources. There are more and more forms of pesticides and synthetic herbicides. And I think
that's connected to that.
Exactly, and that is being ingested by women. Third of all, remember, we are looking at all women, but African American women are more prevalent to this. Most black women, a lot of them, we are getting the estrogens, excessive estrogens from what? We're getting it from our food. We're getting it from our environment. Then you get phthalates that when you perm your hair, that goes into the bloodstream. Now you got a third source. Then 80% of all African American women are overweight. That's causing more. So not only do you have these outside environments, then you have things that we're adding on that's causing even more problems. So it's giving you a greater prevalence of having a fibroid. And then you're not working outside. Your vitamin D levels are low. So look the correlations there. Environment, food, putting on your scalp, being overweight, not getting enough sunlight. So what happens? All the things that is needed for the fertilizer to make these fibroids grow, you're just putting on into the womb. And then we talked about trauma. Trauma is another thing. Women hold trauma in their womb. Heart, liver, womb. They hold it in their womb. Okay? So if you have a lot of trauma, you're more likely to have fibroids. So, look at what's going on. Yeah, so let's look at what's going on. So those are the issues when it comes down to fibroids. Fibroids is a big problem. It's becoming bigger. They say 80% of all women just in general may have fibroids. 80%! I ain't talking about black women, I'm talking about women just in general. 80%. Maybe 40, 50 years ago, this was probably like 40% or 50%. 80%. Some people may not even notice it. It's the size of a rice. It doesn't affect you. Then there's people who have, I'm telling you, I seen a woman come in, she looked like she was 6 to 7 months pregnant. A family friend of ours, back in the 90s, she had massive fibroids. Massive fibroids. Slender sister. Massive fibroids. You thought she walked around for years. Everybody thought she was pregnant. She just had massive fibroids. And she got to weigh like 125 pounds.
So when they get that big, how do they get rid of them?
They can do a hysterectomy. They can do a myomectomy. They have so many ways. She was one of the first to get. I think at the time it was a new procedure with the myomectomy where they just cut out the fibroid itself. Versus it was always they would take your whole womb. It was always fibroid's too big, you're bleeding too heavy. Let's take your womb.
Yeah.
But now they have.
I remember when that was a popular thing.
Yeah, now they have much more. They have more procedures. I like the procedure is like I like the one that kills the blood supply. But I mean, if you don't get rid of the root structure, they always grow back. The herbal formulas that we talked about, the dissolving formula, the womb tea, the fibroid combination, the African woman back tonic, all these things, the chaparral red clover, not only they help break up the fibroid, but they also help get rid of the root structure, and that's very important.
Okay, thank you.
No problem. If that's it, this was a good topic. I enjoyed this. This was about women.
Yeah, it was.
Because it affects so many women. 80% of the women. 80% of the women. And remember, the world is actually more women than men. It's actually more. It's like 51% women, 49% men. So this affects a lot more people than we realize. And it's not just black people. It's actually all women it affects. But African American women are 2 to 3 times more, have more prevalency of getting fibroids. But if that's it, no other questions, because we can shut it down. Because we at 9:59. So if you want to shut it down, we can shut it down right now.
Get 1 minute.
Oh, I'm okay with, I'm always, they always say at work, I like to leave early, so it's okay. Well, listen.
Well, thank you. Good topic.
What'd you say?
Can I get the spelling for the body of Lathan? I don't know if it's Lathan with a K or Lathan, like
Lathan. Body by Lathan. That's the name of the product. By the name of the company. Body by Lathan. Leigghton. Lathan. The name of his formula is called Fibroid Combination. Fibroid Combination. The other one is a company called Secrets of the World, and that is called Dissolving Formula. And then you have Dissolving Formula. Go ahead.
I wrote down BD212.
BD212, yeah.
Is that the same thing as the dissolving?
Yeah, that is dissolving. That's the BD212. So they come up with a formula. They have numbers for their formulas in the name. It's called dissolving. And then you have the womb tea by One Love. That's the name of the company, One Love. It's called the womb tea. And then you have Sundial. That's the name of the company. It's called African Woman Back Tonic. Or is it Ghanaian Woman Back Tonic? It's African Woman Back Tonic. Those are the 4 I know. I'm telling you, it's a lot out here. It's a lot.
These can be purchased in a health food store.
You can purchase some of these you can't. You can find them online. I know the dissolving is not too many places sell that one. I know we sell it at the store, but that's other formulas out there. But the dissolving is the one I've seen the longest. Doesn't mean it's for everyone. That's the one I've seen people get the most response from. It comes in capsules and in tea, But some people don't like to do the Chinese stuff, and I say, okay, that's cool. I understand. But this is the one I've actually seen for like over 20 years' work. But the Body by Lathan one, the fibroid formula, is a very good formula too.
Okay.
So y'all have 4 things. I gave y'all 4 formulas to use. All right?
All right. You have a good day.
Well, thank y'all for tuning in to the Health Man Show. Once again, you can always reach us at 520-525-8633. Once again, that's 520-525-8633. Thank you for tuning in, and like, share, and subscribe to the video. Thank y'all so much. Good night, y'all.
Thank you.
Good night.